action.
Good morning, sir. How are you doing today?
Good. Oh, good.
Okay. Just let me double check that the door is closed to provide privacy. Please, can you tell me your full name and date of birth?
My name is Mark Mahoney. I was born January 26, 2002.
Okay, that's great. Let me double check this information on your wristband just right here. Okay. Can I ask you, do you have any allergy?
No.
Okay. Are you in pain just right now?
No.
Okay. May I ask you, have you have any head and toes assessment
Yes.
in the past? Okay. Just let me to do a little refreshment about that. The head and toe assessment is examination to your complete body. I'm going to check some system like the head, cardiovascular, respiratory, abdominal, and your muscle strength, just to collect data that your provider is going to be using in the future. Is that okay? Do I have your permission
Yep.
to do that? Okay. Before to start, I'm going to take set the vital completely. May I know in the last 30 minutes have you smoked?
No.
Have you drink coffee?
No.
Have you exercised?
No.
Okay. It's important for me to know this information because this kind of activity can give me normal values. So that's why I'm asking this information. So today, since this is our first time we meet, I'm going to take your blood pressure in 2 steps. I'm going to inflate the cuff till I stop feeling your pulse, and then I'm going to take it one more time, going up for 30 millimeters of mercury. Actually, I don't need that. Okay, your baseline is 110. So in a minute, I'm going to take it one more time, and I'm going to be 30 millimeters over 110. Okay. While we wait for taking this blood pressure one more time, may I know what do you have for breakfast this morning?
Pancakes.
Okay. May I know what's your mother maiden name?
Crane.
Okay, thank you. And lastly, do you know where you are right now?
I'm at the hospital.
Okay, and do you know what today day is?
It is Wednesday.
Okay, thank you. I'm going to take one more time the blood pressure. Okay, your blood pressure is within the normal range. You have 120 over 75 millimeters of mercury. That's quite normal. And now I'm going to take your blood oxygenation. And while I'm doing that, I'm going also to take your temperature. Okay, that's 99. That's within the normal range. And we also have here 99 as well. Let me take your pulse. Okay, thank you. The respiratory rate is within the normal range. You have 16, and the pulses are also within the normal range. You have 80. Okay. Now we're going to continue with the assessment. It looks like you are not connected to any devices, any machine. You are not having supply of oxygen. Do you use any device to ambulate?
No.
Do you need assistance while ambulating?
No.
Okay. It looks like you're oriented because you know where you are. You know information that that's accurate, so we can proceed with this assessment. To start, I'm going to inspect your head. We're going to start from top to bottom. So starting by the head, it looks like your head is normocephalic. There is no any malformation. The symmetry looks to be good. I'm going to palpate, looking for any fracture and any bumps. It is important also to notice any the hair distribution. There is no appearance for lesion on your head. So moving on, I'm going to inspect your ear. I'm going to look for any drain coming from your ear. Okay, there's not. Can you look to the other way? Okay, there's not. Let me know please if you have any pain while I'm palpating here.
No.
No? Alright. Perfect. They look to be symmetrical. They align with the eyes. Now I'm going to inspect your eyes. Okay, can you look straight for me? Okay, your sclera looks to be white. There is no change of color. There is no jaundice. While doing or inspecting your lower eyelids, there is no petechia on both of them. And now I'm going to inspect the pupil. To inspect the pupil, we're going to use the PIRLA acronym, which means pupils are equal, round, reactive to light and accommodation. I'm going to put sunlight on your eye. It could be a little uncomfortable, but it's just gonna be for a few seconds. Okay, can you look straight? All right, thank you. Okay. Thank you. All right, that's perfect. Now, can you please follow this pen? All right, perfect. Now, please let me know if I'm doing too quickly or you feel dizzy. That's perfect. Your pupil react to the light in the accommodation.
So
Now I would like to move on. I'm going to inspect your nose. I'm going to palpate your nose, looking for any inflammation, pain, or swelling. Are you having pain?
no.
No, okay. I'm going to inspect your septum, looking for any deviation. Okay, your mucus look to be hydrated, it's not dry. And now I would like to move to your mouth. Your mouth, your lips look to be normal. Looking inside your mouth, I'm going to inspect your gum. I'm going to inspect your teeth, looking for any cavity, any denture. Do you use any denture?
No.
Okay. I'm going also to ask you to open widely to be able to inspect the back, the throat, the tonsil, and the top. To do that, I'm going to use this tongue depressor. I'm gonna put under your tongue, and I'm gonna ask you, can you take out your tongue and say ah? All right. Everything looks to be good there. Okay, the mucus is hydrated. There is no dry. There is no cavity. There is no denture. And now I'm going to move to your neck. In your neck, I'm going to palpate the thyroid. Can you please swallow? Okay, thank you for doing that. Now I'm going to palpate, looking for any inflammation in the nodule. Right here we have the preauricular, postauricular, occipital. We have the submandibular. We have the submenton, just right here, and then we have the tonsil, just right here. The supraclavicular, just right here, and the infraclavicular, just right here. Also, I would like to have to inspect balls in the carotid just right now. It is important to do this just one at a time. Okay, I would like to say that this pulse is rhythmic and at good rate in the grade X2. Okay, that's perfect. I'm going to take a little moment to auscultate for any fluid. Okay, no fluid, which is good. That's what we expect to find in a healthy person. Now I would like to move to the thorax. In the thorax, there's two important systems that I would like to check. One is going to be the respiratory, and the other one is going to be the cardiovascular. So starting by the respiratory, I would like to say that your respiratory rate was 16 per minute, which is within the normal range, and your blood saturation was 99 without having any supply of oxygen, and also 99 to air room is within the normal range. Before starting more deep on the thorax, I would like to have you have in the past any surgery on your lung?
No.
Have you been diagnosed with any chronic disease like a COPD or asthma?
No.
No. Okay. Are you having cough just right now?
No.
Okay, perfect. So to inspect your thorax or your lung, I would like to palpate. Use keep straight. Okay, now I'm going to ask you to take a deep breath. Okay, let me do this one more time in the back. Can you please give a hug yourself? Okay. All right. Thank you. I'm doing this because I need to look for symmetrically. So trying to see that both lungs expand the same time and at the same amount. Now I would like to auscultate your lung. I'm going to do this anterior and posterior too. Okay, can you please breathe? Okay. One more time. Okay. One more time. Okay. One more time. Here. One more time. Okay. One more time. Okay. One more time. Okay. Last time here. Okay. Thank you. I'm going to auscultate back. Let me close this. Okay, can you breathe? Okay, one more time. Okay, one more time. Okay, one more time. Okay, one more time here. Thank you. One more time here. Thank you. One more time here. Okay, one more time here. Okay, thank you. Your lung sound clear. There is no abnormal sound. There is no rhoncus. There is no crackle or wheezing. Everything looks to be good for now. Now I'm going to move to the cardiovascular portion or system. May I ask you, are you having chest pain right now?
No.
Are you feeling fatigue? Are you feeling like having a hard time to breathe?
No.
Fatigue?
No.
Okay. Have you taken or receiving any medication for the heart condition?
No.
May I ask you how frequent do you consume alcohol?
Never.
Never. Okay. What about coffee?
Never.
Never. What about smoking?
Don't smoke.
Chewing tobacco?
I do not chew tobacco.
Okay, thank you. Now I would like
What
to.
was that in relation to?
I'm sorry, say that.
Oh, is that to the heart?
Yeah, to the heart. Yeah. Now I'm moving to auscultate your five landmark or heart sound. I'm going to start at the right side. Second, mid clavicular line. Okay, right here we have the aortic sound. Okay, moving to the next side, at the left side, second intercostal space, we have the pulmonic. Okay, now moving to the third intercostal space, we have the air point. Okay, moving to the fourth intercostal space, we have the pulmonic. That tricuspid, I'm sorry. And then mid clavicular line, fifth intercostal space, we have the mitral. Okay, I would like to state that while ausculting your heart, S2, S1 and S2 is easily recognized or identifiable. It's easy to identify S2 at the top, at the first two landmark, and S1 and the last two landmark at the tricuspid and mitral. So now I'm going to ask you to lay laterally over your left side, and I'm going to ask you to move this. Okay. I'm doing this because I would like to inspect the point of maximum impulse, which is used right here. I'm not quite sure if you are able to see it, and now I would like to palpate. Okay. It is easily palpable, and it is arrhythmic, and I'm going to rate at 2. Okay, now since you're laying right there, I'm gonna ask you to keep on that position. I'm going to uncover your chest. In a normal evaluation, I have to do this inspection before doing the palpation and auscultation. Your chest looks to be anatomically correct. There is no tonal shape. The hair distribution looks to be normal. The nipples are equal at the same level, and there is no any injury on your skin. There is no also change of color. There is no jaundice. There is no pallor, no erythema. Okay, and since I have your torso uncovered, I would like to evaluate first your abdomen portion. I'm gonna do first all the cardiovascular. Okay. First, I'm going to evaluate all your peripheral pulses. For this occasion, I'm just gonna be unilateral, use one side, but it is important to know that these pulses can be checked bilateral if we believe that there is any vascular condition or disease. So right now we have right here the carotid, we already did, and right here we have the brachial. Okay, we also already took this pulse when we were talking or we were taking the blood pressure. Right here we have the radial, we also check this one. Right here in your by your groin area we have the femoral pulse, but we're going to skip that one for today. Right here we have the popliteal pulse, okay, which feel rhythmic, a good, and I'm going to grade all these pulses as 2. Okay, this is easily identifiable too. It's feel rhythmic and grade as 2. And right here we have the dorsalis pedis as well. Okay, I'm going to grade these balls as well. Now that I'm here, I'm going to inspect for any edema. I'm going to try to do the beating, but there is no, which is good sign. I'm going also to check the capillary refill on both extremity. They're less than 3 seconds, which is normal. I'm going to inspect on your fingernails too in the hands. They normal. I'd like to say that it's less than 3 seconds. And while I'm doing this, I'm also checking for clubbing. You don't have any sign of clubbing, which is great. So now I would love to move to the abdomen area or portion. You look to be comfortable there. No guarding, no sign of pain. Are you having pain in your abdomen area right now?
Not often.
No, all right, perfect. May I ask you, what's your habit of bowel movement? How frequent do you go to the bathroom?
Well, once every 1 to 2 days.
Okay, that's within the normal. May I ask you, what is the consistency of this stool when you go to the bathroom? They are
Little long, soft.
okay, that's great. That's within the normal. Have you noticed any time any blood or blood stool?
No.
No. Okay, thank you. Now I'm going to uncover your abdomen area. Okay. The umbilicus is just right in the middle. The hair distribution looks to be normal. Your skin tone color is in agreement with your ethnicity. There is no variation of color. There is no jaundice. There is no pallor. There is no erythema. I would like to ask you: have you noticed recently any new moles or any
No.
lesion? No. Okay, perfect. There is no sign of wound, any wound, any scar. Now I'm going to auscultate your abdomen area. I'm going to start in the right lower quadrant. Okay, that's okay. Okay, your abdomen is normal active. There is no hypoactivity in any of the quadrant or hyperactivity. Are you having any diarrhea or constipation lastly?
No.
No, okay, thank you. I'm going now to auscultate your abdominal aorta looking for fluid. Okay, there's no fluid, which is good. I'm going now to palpate your abdomen. Let me know if any of these movement that I'm gonna do cause any pain. Okay? Are you having pain here?
No.
No. What about here?
No.
No. What about here?
No.
No. What about here?
No.
What if I do this? Did you experience any pain? No? Okay. May I ask you to bear down to see if there is any hernia? Okay, there is no protrusion, so there is no evidence of hernia at this point. Okay, now moving on this assessment, I'm going to inspect the skin. I have been doing through this whole process, but I would like to take time to inspect. Okay, your skin feel to be warm and dry. There is no sweat at this moment, which is good. Okay, skin look to be integrate. There is no the coloration, there is no color change. It's completely symmetrical on your whole body and is in agreement with your race. Okay, now I would like to move to the neurological part. In the neurological part, I'm going to give you two, I'm going to whisper two words, and then I'm going to ask you these two words. Can you tell me these two words?
Did you say dog and apple?
Yeah, that's correct. That's the two words that I told you. That is part of the neurological assessment. I'm testing your immediate memory. I already test your remote memory when I ask about your mom name, and also I test your immediate when I ask you what do you have for breakfast this morning. So it looks like you're conscious and you're oriented. So another thing that I would like to examine on your neurological is there's some cranial nerve that I would like to evaluate. One is going to be the olfactory. I'm going to give you a scent to smell, and you must be able to recognize it. Another cranial nerve that I would like to examine is the cranial nerve number 9 and number 10. I already did this assessment when I asked you to swallow while I was palpating the thyroid, and you were able to swallow. So it means that the cranial nerve are cranial nerve number 9 and 10 are integrated. And then to examine cranial nerve number 11, I'm going to ask you to move your head again, resistant to the other side, now to this side, and now can you pull just, okay, that's perfect. Then the last cranial nerve that I would like to examine is going to be 12. I'm going to ask you to pull out your tongue out of your, okay, that's perfect. Now can you push against your chest? Okay, that's quite perfect. Thank you. Now I would like to ask you, please come out of the bed. I know you look comfortable there, but I have to evaluate this. Okay, I'm going to ask you to keep your feet closed and close your eyes and stay right there. Okay, that should be enough. You can remain steady. Now I'm going to ask you to walk to heel to toe over this, over there. Okay, thank you. Now, can you walk around this room? Okay, you look to walking without any discomfort. Okay, that's gonna be quite nice. Now, can I ask you to jump the jumping jack? All right, thank you so much for doing that. I'm checking for coordination at this point. So now I'm going to asking please take a seat. I'm going to evaluate the deep tendon reflexes. I'm going to mention some of them, but I'm just going to inspect one of them today.
Which one?
Okay. I'm going to inspect the patella today, but also I would like to tell you that we can inspect the tricep just right here, the bicep just right here, the radial just right here, the patellar is just right here, and the Achilles is just right here. It is important to check this one, to checking for how they react. They can be hyporeactive or hyperreactive depending on the condition, but I'm expecting to find them well, since you look to be healthy. Okay. Okay, they react normally, so I would like to grade them as 2, which is really the normal. Now I'm going to assess your musculoskeletal. First, I'm going to ask you, I think I already did. I asked you if you use any device to ambulate.
Yes.
That's correct. Okay, perfect. Thank you for reminding. I'm going to ask you to move or to push your hand against mine. Will you push it? All right. Now opposite. All right, perfect. What about kicking this leg? Okay, that's perfect. Now this one. All right, that's quite strong. That's great to know that your muscle strength is good. Now I would like to ask you to keep. Please, can you get out of the bed? Okay. Now, can you please see the mirror? Okay. Now I'm going to check the symmetry on your shoulder and your hip, looking for any scoliosis or any deviation of the column. And now I would like to ask you, can you please bend? Okay. I'm going to palpate your spinal process, checking for any pain. Are you having pain while I'm doing this?
Nope.
Okay. Okay, thank you. You can start it. Okay. Now, can you please sit? Now, I'm going to ask you to perform this this movement with your arm. Okay, are you having any pain?
No.
Okay, I also cannot feel any crepitus just right here. What about this?
No.
Okay, this one?
No.
Okay, are you able to move your hands just okay, no pain at all?
No.
Okay, what about this? Can you move this knee? Okay, what about this other knee? Any pain?
No.
Okay, I can also don't feel any crepitus. What about the feet? Are you able to move? Any
Yep.
pain?
No pain.
No, okay. So it looks like your range of motion are within the normal. Your muscle strength is also within the normal. And so I'm going now to share all this information, and I'm going to leave you in this bed. Can you please lay on it? May I do something for you before I leave this room? Do you need something to be more comfortable?
Can I have a water?
Yeah, absolutely. I'm going to bring water for you. Okay, thank you.